How you doing? I'm student Dr. Chittenden.
Hey, how you doing?
Nice to meet you.
Nice to meet you.
What brings you in today?
I'm dealing with some heel pain on my right foot.
Okay. And how long has that been going on?
It's been 3 days now.
About 3 days. Any specific activity or event that started this?
Just walking a lot. Yeah,
Okay.
I do a lot of walking.
Okay. Is the pain constant or is it going on and off?
It's a constant pain.
Constant pain. If you were to describe the pain, how would you would characterize it? Like sharp, dull?
It's a sharp pain.
It's a sharp pain. What makes it worse?
Just when I'm on my feet a lot.
Okay.
Yeah.
What alleviates it?
I would say rest.
Okay.
Yeah.
And where is it exactly?
Right in this area.
Right in this area here. Okay. Does the pain come toward your toes or up the leg a little bit?
No, it does not.
Okay. So if I was to give you a scale from 0 to 10, 0 being no pain, 10 being a trip to the hospital,
Yeah.
what would you give that?
It's a 6.
About a 6. Okay. All right. I want to talk a little bit about your medical history, if I can.
Okay, sure.
Have you been hospitalized?
No.
Any sort of surgeries?
No.
Any illnesses that you've had as a kid now or as an adult?
No.
Okay. Are your immunizations up to date?
Yes, they are.
Okay. Are you on any medications?
No, I'm not.
Any allergies to drugs or any sort of food or anything?
No.
Any blood transfusions?
No.
Okay. Patient is alert and aware. The next thing I want to do is I want to talk a little about your family.
Okay.
Are your parents alive?
Yes, they are.
Okay. Are you aware if they've been diagnosed with any sort of diseases such as cardiovascular, hypertension, diabetes, or any sort of serious illness like cancer?
No, they have
Okay.
not.
Any siblings?
2 sisters.
2 sisters. Have they been diagnosed with any sort of serious illness?
No.
Okay. I want to talk a little about your social history if I can.
Sure.
What do you do for a living?
I'm a student.
Okay. Do you exercise?
I do.
Okay.
Yes.
How many times?
About 2-3 times a week.
Okay. Have you traveled outside of the country?
No.
Okay. Are you single or married?
I'm married.
You're married. Do you have a monogamous relationship with your wife?
Yes.
Are you sexually active?
Yes.
Are you practicing safe sex?
Yes.
Okay. How much sleep do you get a night?
About 7 or 8 hours.
7 or 8 hours. Do you smoke?
No, I don't.
Do you drink?
No.
Do you do any sort of illicit drugs?
No, I don't.
Okay. Any pets?
I have a dog.
You have a dog.
Yeah.
Okay. Okay. What I want to do is go into the exam at this point.
Okay.
All right. So what I'm going to have you do is just kind of scooch back a little bit. I want to take a look at pretty much your overall skin and your toenails and everything.
Okay.
So I'm just going to now take a look at your toenails to make sure that they're nice and clean and looks good. I don't see any injuries. I'm going to look between your toes, look for macerations or anything. I'm not seeing any sort of macerations or cuts or lesions at all. I'm gonna look down the side of your foot here, looking for thickening of the skin. And I don't see anything, any discoloration of any kind. I'm gonna look at the plantar surface here. Looks good. Come over here, take a look at the nails. Looks good. Looks good, okay. Discoloration's good. Surface heels good. I'm going to lift your leg.
Okay.
So make sure that there's nothing underneath. Okay. This leg here. Looks good. All right. I don't see any discoloration, normal hair growth. I'm going to just take your temperature real quick.
Okay.
It feels warm. Normal. Good. Okay. The next thing I want to do is go through a vascular exam.
Okay.
I'm going to start with your capillary refill here.
Okay.
That's normal. 1 to 3 seconds. Next thing I do is palpate your pulses. That's strong. Strong. Here, maybe knee a little bit. Strong. That's strong. Good. Okay. So the next thing I'm going to do is we're doing musculoskeletal exam.
Okay.
The first thing I'm going to do is going to check the range of motion of all your joints.
Okay.
The tarsal. Extend your knee. I'm gonna do a test here to see if this is the involved side.
Okay.
Feels tight. Extend your knee. Good. Okay. Next thing we're going to do is strength test.
Okay.
So you're going to bring your feet all the way toward your head. Keep them here nice and strong. I'm going to try to pull them away. Don't let me do that. Keep it strong. Very good. I'm going to push them towards your head. Don't let me do that. Keep it strong. Good. I'm going to turn your feet in. Don't let me do that. I'm going to turn your feet out. Don't let me do that. And relax. Good. Okay, the next thing we're going to move on to is a neurological exam, kind of to see how your skin is reacting, if it's normal, if it's intact or not. So I'm going to use this. For this test basically is going to test the sensation of your skin. You're going to feel this on the bottom of your foot. You're just going to tell me, I feel it.
Okay.
Okay. Close your eyes, please.
Feel it. 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 Feel it.
Good. Open your eyes. Next test would be what's called sharp and dull. You're just going to tell me when you can feel this is sharp and then this is dull.
Okay.
Close your eyes, please.
Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Okay.
Sharp. Dull.
Okay.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull.
Good. Open your eyes. Next we're going to do is what's called a vibration test.
Okay.
So basically I'm going to hit this, put it on your bone, you tell me when it vibrates and then when it stops.
Okay.
Okay? Close your eyes, please.
Vibrating. Stop. Vibrating. Stop.
Good.
Vibrating. Stop. Vibrating. Stop.
Good. Just relax. Okay, open your eyes, it's good. Next we're going to do is a reflex test. I'm going to have you scooch over so your legs are kind of dangling off the table here. Yep, great. Just relax. Good. 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 Good, relax. Okay, that concludes the exam.
Okay.
Relax now. So basically I determined that you have a inflammation of the bottom of your foot, possibly something called plantar fasciitis.
Okay.
What I'm going to do at this point in time is I know that you complained about pain, so I'm going to prescribe you some ibuprofen 800 strength.
Okay.
You'll take it about 3 times a day
Okay.
for pain. I'm also going to order some x-rays and MRIs. I want to rule out any sort of fracture or any sort of other injury or laceration that might be something where I can't see.
Okay.
I also am going to give you some stretching and some strengthening exercises, and I want you to do those every day. Okay, I'll give you the instructions on how to do them, and hopefully that will help alleviate the pain, also prevent this from happening again.
Okay.
I'm going to have you follow up with me in 2 weeks. You'll come back, we'll go through the exams together, and at that point we'll determine what the treatment plan will be.
Okay.
Any questions? Any questions?
No questions.
Okay. Nice meeting you.
Nice meeting you.
Have a good day.